off the occlusal surface. What are we gonna use? A Profi cup, what do we use? A brush, right? So a bristled brush. It could be flat or it could be tapered, okay, so that it fits nicely right in those occlusal surfaces. Okay, so these are called preppies. This has pumice already in it. So it's little individual dispense, unit dispensed pumice. So some offices might have this, or they're gonna have just a large thing of pumice that you'll go and kind of single dose into a dappen dish of some kind, okay? So basically into one of these. When it's just that powdered form, you have to add a little bit of water to make it into a paste. These might be dried out, I don't know.
They shouldn't be.
No, okay.
They're
Sometimes
newer.
these get dried out because imagine you don't use it all that often. But in some cases, if patients are allergic to fluoride or if they're allergic to different dyes or flavors, this is like plain. So a lot of times you might hear them call it plain pumice. It doesn't have any kind of additives, so this would be something that you could grab to use. Okay. Okay, so we're gonna clean off all those pits and fissures. And so remember, you can do all of the teeth that you're gonna be sealing all together. Okay, so we would go to number 3, do number 3, number 14, okay? In those pits and fissures. What's our next step? Rinse. So we would either have the patient rinse, is there water in there? We would either have the patient rinse or we could rinse for them. So in the case of when we're utilizing this, when we're practicing, this is how you'll do it. You'll just come over to the unit, take the air water syringe and do it right over the sink, okay? Wait, is it, someone turn the compressor on? You're the best, Sam. Let's give it a second. Is this the one that doesn't work?
No, that one works,
That one
but
works?
yeah.
Does
it's-
this one work?
No.
Alright, there we go. Alright, so, rinsing it off, okay? Rinsing it. Drying it off. At this point, what do we do next? Isolate. So we have a couple different isolation methods. We have just our cotton rolls. So remember, if it's a lower, it's gonna be on the buccal and the lingual, okay? If it's on the upper, just on the buccal. So we have a couple different versions of isolation. This is one that can go in, the suction is attached to it, and it's just gonna take some of the suction away, of the saliva away. These are cotton roll holders. Some offices have these, so it's just this little plastic piece that holds the cotton rolls, and it just kind of nicely will go right next to the teeth. So in here, it would be you place it in. Do it this way. Okay, so it's just a way that those kind of stay in. So if we needed to replace it, you can either have multiple of these set up, so when you take that out, you put another one in, or you take the wet cotton rolls out and put them in. Okay, but for the sake of this, we're just gonna hold our isolation right up next to the tooth. All right. So etch is gonna come in the form of a syringe. We'll take the cap off and put the new cap on. Most etchant syringes come straight. Some of them will come bent like a contra angle. It's ideal to just bend it on your own if it's not bent, okay? Because remember, anything that's bent is easier access inside the mouth. So we're gonna place our etch into the pits and fissures. How long are we gonna wait? How about what's our next step? So at the beginning of the procedure, you can put all of the tips on at that point, okay, when you're ready. So we'll rinse it. Take it over to the sink. We'd have our suction, right, in their mouth. There would be suction going, so when you're practicing on your Typodont, you can do it just like it was an actual patient. So you would use the HVE, okay? And we're gonna rinse it. How long do you rinse the etch for? So it's around 15 seconds or so. Okay. So my cotton roll is super wet, so I need to re-isolate. So I'm gonna take that. I typically will have a cup like we've used for other procedures, cup for my trash, but I'm gonna re-isolate. And what's my next step? Dry, right? We want to make sure that there is no moisture contamination, okay? So, drying the tube. Patient is going to stay open. We're going to place the sealant. So this is that sealant material that I told you about that is that pink color. So it's going to help us to look right in those pits and fissures. So look at how fast it comes out. That's normal. So we don't want that much material, because that much material would cover 10 teeth. So one thing you can do is just get that little ball of it on the edge of on the tip of the syringe, place it right on, okay? Right into those pits and fissures. Okay. So we talked about you can then go in with your Explorer if you need to make sure it's getting into the pits and fissures. One other thing is, like, I can see that there's some extra there that I don't want. You can go in with a cotton roll and wipe any excess off that might be on that biting surface. Because what we're looking to do is seal deep into that thing, into the pits and fissures, right? So having it all built up on top of the tooth surface doesn't do anything for us. That's not what we're trying to seal. We're trying to make sure that we're filling in all of those pits and fissures, okay? So now we've filled in the pits and fissures, and we're gonna cure it.
Don't look at the light.
I'll turn it on. So we would use a shield, orange glasses, whatever we kind of had. So what's gonna be our next step once this ends? Right, so we're gonna check for retention first. So we're gonna take out any kind of isolation technique that we might have. We're gonna take our Explorer, and we're gonna feel to make sure that there's smooth contact surfaces and that there's nothing that's touching. So now you can see in the case of this, the pink is gone, and we have just a nice clear sealant. All right, so feels good, looks good. We can now take our articulating paper. We would have our patient bite down. We would check the occlusion. If everything looked okay, what would be our last step? Flossing, right? So we would take our floss into proximal. We want to make sure that there is no, we didn't get any sealant that was blocking that contact. If everything looks good, patient is done. If we need to do any kind of a fluoride treatment, we would do that then, okay?
So does fluoride go into, like, does it absorb the fluoride?
No, the sealant material, no. No, it shouldn't absorb anything, and that's why we make sure that it's totally retained and adhered to the tooth structure, because we don't want anything leaking down in there, okay? So very similar steps to the composite, right? Keeping everything super dry, etch, material, light, occlusion, floss.